Physician-assisted death, going beyond moral and ethical principles. I'm Ian Laksamana, the presenter of our group. If you have a patient who has been terminally ill and requests you as their physician would let PAS be done to them, would you do it? PAS in ethical and moral issues. Physician-assisted death is a certain issue from a moral and ethical standpoint, since there is a big deal in the respect of a person and one's choice to life. Physician-assisted death, despite of its main purpose, which is to shorten one's suffering from pain, has been faced with questions and opinions that states the otherwise. Physician-assisted suicide does not enhance the choices or freedom with health conditions. The objectives of our paper. First, to identify the ethical principles that physician-assisted suicide violates. To observe the comparisons of the laws of physician-assisted suicide between the Netherlands and the state of Oregon and California. To enumerate the ethical dilemma noted on the regulation. And to distinguish the points of physician-assisted suicide that violates the Hippocratic Oath and the Nuremberg Code. For the methodology, the paper consists of the descriptive type and bibliographical type of research. The group gathered related issues and articles pertaining to physician-assisted suicide, and we sort and pick out the most relevant topic. The subtopics are as follows. The Hippocratic Oath, which apprehend how does the community of medical professionals should face euthanasia. The group also examined the laws of the states which legalize euthanasia or physician-assisted suicide as one of the options for approaching end-of-life care, like the states of Oregon and Netherlands. Lastly, we provided this research one of the options for a morally right and ethical way to face this problem, which is the palliative care. Discussion. Physician-assisted suicide has been a controversial topic despite being legal in different states. Two of the states with legalized euthanasia is the state of Oregon and California in the United States, as well as the other country. Netherlands, which will be further discussed in this research. These three places have a set of guidelines in accordance with the law of legalized euthanasia. Here are some laws cited. For the Netherlands, first, euthanasia must be performed in accordance with careful medical practice. All cases will be evaluated by a legally constituted regional committee composed of a doctor, lawyer, an ethicist, and others. Euthanasia and assisted suicide will not be punishable if carried out by a doctor who has complied with the guidelines and reported it to a local medical examiner. After satisfying himself that the required procedures had been carried out, the examiner is to send his report to the regional committee and to the prosecutor. Children between 12 and 16 must normally have their parents' consent before they may request euthanasia. However, in exceptional cases, those involving serious and incurable disease or intolerable and unrelenting suffering, a doctor may agree to such a child's request even without parental request. Requests by children aged 16 to 17 do not require parental consent, though parents should be involved in decision-making. Lastly, competent patients may request euthanasia by way of an advance directive, to be later consulted in the event that they may have become incompetent. In the state of Oregon, first, the person must be terminally ill. The person must have 6 months or less to live. The person must make 2 oral requests for assistance in dying. The person must make 1 written request for assistance in dying. The person must convince 2 physicians that he or she is sincere and not acting on a whim, and that the decision is voluntary. The person must not have been influenced by depression. The person must be informed of feasible alternatives, including but not limited to comfort care, hospice care, and pain control. And lastly, the person must wait for 15 days. In the state of California, first, the person must be terminally ill and is expected to die within 6 months. In order to be eligible, the information must be based on a medically confirmed diagnosis. The person must obtain a medical health screening to confirm the patient has the capability to make these decisions. The person must be a resident of California and must have established residency, voter registration, and proof of property ownership. The physician is not allowed to prescribe lethal drugs as requested by the patients until after 3 requests are made at least the 15 days apart. The person must previously give a power of attorney or close family member. The person in pain must be legally competent to give such power. Quote and unquote. It felt to me like it would have been so much better if he and his patients didn't have to take on all that risk and fear. The line was said by the lawyer of John Hospice, 78, is a resident in Canada, who is a physician-assisted suicide activist. He, himself, admitted to killing 8 people through his underground secret suicide service and considered himself nothing different to killers, who are facing mandatory life sentence under the Canadian law. The Hippocratic Oath. The Hippocratic Oath is a devotion to human life, which clearly is a violation when one enters to acts doing harm to human life. Quoted from the classical Hippocratic Oath, I will apply dietetic measures for the benefits of the sick according to my ability and judgment. I will keep them from harm and injustice. It is a human obligation to develop a legitimate approach to end of life, without degrading the dignity of the partaker in the said context. As Pope Benedict XVI stated in address to the ambassador of Grand Duchy of Luxembourg to the Holy See, political leaders who have the grave duty of serving the good of human beings, and likewise doctors and families, must remember that deliberate decision to deprive an innocent human being of his life is always morally evil and can never be licit. Quote and unquote, do no harm. The core of the Hippocratic Oath. Human beings are made by God free agents, but their freedom does not extend to the ending of their own lives or ending someone's lives. This is not only for the terminally ill, but the professionals must also think about not to alter the medical profession's role in the society. For the results, the following table consists of the criteria in the guidelines of the laws of the states with legalized PAS. Also, the violation against the Hippocratic Oath, Nuremberg Code, and ethical principles. Limitations of the research. First, the principle of double effect upon making decision and physician-assisted suicide. Next, the distance of Philippines to the said states and countries, being unable to have a clear view on the laws implemented, hence being limited to only limited resources. And lastly, the limitation of bringing up Christian doctrines, as we are a Catholic-dominated country, but with the states of legalized PAS are not up to par as to being called as a Catholic-dominated country. Concluding this presentation, a physician, as proclaimed by their Hippocratic Oath, is to provide all what they can do to heal the patient. Physician-assisted suicide violates the moral principles, which consist that a physician should provide minimal harm. Even if the patient asks for it, using his or her autonomy, the physician should not compel to decisions such as ending a person's life, for it violated their service to the people, which is to heal them, promote the idea of hope and love for the betterment of the patient, let it be emotionally, mentally, and spiritually, and to help patients recover fully despite the future events which might occur. To end this presentation, a quote from the Blessed Pope Francis states, "A little bit of mercy makes the world less cold and more just." Thank you and God bless.